At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on WMAL 105.9. Got another interesting program for you, but before I get into that, I want to wish you all a very happy 4th of July weekend. You know, it was kind of interesting. There was a patient that we were talking about and said, you celebrate the 4th of July? And I laughed at them and I said, yeah, every year we always pay honor to, you know, the birth of this country. And we went on and he said, you know, they have 4th of July in Great Britain. And I looked at this patient and I said, what am I being brought into here? And then all of a sudden I realized that he was sucking me into, given the personality, that they have a 4th of July on the calendar too, but it's not our birth date. Anyway, having said that, happy 4th of July and the birth of this amazing country called the United States of America. All right, my friends, let's get into the program. We're going to be talking about different type of low back pain today, something that many of you may not have thought about, that can trigger or cause problems. And, you know, you be outside and you can't figure out why. It's never right. It just never goes away. You've had all kinds of problems, you know, over the years, and they're modified. But all of a sudden, this one problem shows up and you can't figure out why it took place. Well, we're going to add a little bit of on that platform, a little bit more information, something that you probably have never heard of. And I'm going to get into it much more in the live stream when we're done here. You go to drtomroselle.com or all the social media sites that you follow me on, right? Because you're following me. And, you know, we'll kind of do a little bit better explanation of it. But I want you to get this data first. How many of you go to a doc with low back, chiropractor, osteopath, physical therapist, some guy that specializes in pain, whatever, and they ask you all these questions, but did they ask you this question? The question is, when was the last time you had any dental work done, any extensive dental work? Or wherever you hit in the face, did you ever take a blow to the face? Or, you know, did you ever bite on something hard and it just continued to hurt for a long period of time? Why would I ask that question? Well, I ask it all the time when somebody has intractable low back pain, and particularly if they look, you know, I see them in front of me and they look like they're in pretty decent shape. Said, you know, where's this coming from? And I look at their dietary patterns, obviously, because we're going to look at the sugars and the sodas and the coffee and the black teas and the fast fried foods, alcohol, gluten, additives, preservatives, all the junk stuff that they put in their system. And we'll look at it and say, yeah, it's there, but it's not horrible. Could it cause a problem? Of course it can. Can it make things worse? You bet it can. But what's the deal here? Why is this pain persistent, never goes away, no matter what they've done about it? And nobody seems to know why. But the other question is, nobody has asked the question that we just put on the table. Have you had any extensive dental work done? Why is that important? Well, here's why it's important. Every piece of the body has a relationship to other pieces of the body. You look at yourself and say, what? What is he talking about? Well, your right shoulder and your left hip, your left wrist and your right ankle, your right knee and your left elbow. If you watch somebody walk on a treadmill, you're going to see that there are certain gait mechanism patterns and that coordinate the body's stride, if you will. But there are other more subtle relationships as well. For example, what we're talking about, right? We're talking about the temporal mandibular joint, that hinge joint that you have just right there in front of your ear, and you open and close your mouth. You can hear it pop or slide or grind or pop or snap. And that relates to the sacroiliac joint. You know, your iliac, your hip bones. And as it comes together, there's a wedge-shaped bone in the middle. It's called the sacrum. And it's supposed to move almost like a cantilever motion with your legs causing to stay stable. Yeah, some of you are over-endowed. You got a very paid-for waistline. You have an activity level of a gnat. You don't do anything except hang out. Your exercise is, the remote control. So you look at yourself and say, but I haven't done anything. Well, yeah, maybe you did. Maybe it's having not done anything means you haven't gotten off your derriere and done anything at all. And you sit there and you shove all whatever it is you're shoving in your mouth, and obviously that's a problem. But that's not what we're talking about. We're talking about that temporomandibular joint and its effect that it has throughout the whole body. I'm going to talk a little bit more about the vertical dimension of the temporomandibular joint in the live stream, but here's what I want you to get. If you go to a dentist and they clean your teeth, or they put a cap in, or they put a implant, or they put braces in and so forth, but they don't align the temporomandibular joint. They align the dentitia, your teeth, the vertical up and down of your teeth. And they don't pay attention to that hinge, that joint, that TMD that occurs because of misalignment, temporomandibular dysfunction, if you will. You're going to have profound effects throughout the body. It can cause all kinds of things, from headaches to ocular problems to tinnitus. You can get dizziness. You can't stand up straight. All of those things add to it. And then you chew gum, or you crunch on ice, or you chew on your pen or your pencil. All of those things cause irritation to the temporomandibular joint. And subsequently, it can cause problems with what? With your low back. On the 16th, coming up very quickly, in about a week and a half, Dr. Harlan Browning and I will tag team, and we're going to be talking about low back pain. But I'm going to show you specifically what can happen if that temporomandibular joint is not aligned properly. And I think you're going to be amazed at what takes place. And it's not because you got bad guys out there, bad intention in the dental field. It's just the way it was trained years ago. Many of the schools now take into consideration that they have to be very careful and focused on that temporomandibular joint. So here's something that I want you to bear in mind. And you've heard me talk about it before. If you go to the dentist and you have work done, and they take that little piece of carbon paper, you put it in your mouth, and they go tap, 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 slide, 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 they're looking for the occlusion of the teeth, not the temporomandibular joint. And so if the occlusion of the teeth is off, then they grind it down. They're talking about microns. And once it doesn't hit or irritate, they think it's not going to distort anything. But that's not the case, because that gap now, that lack of contact, can cause a profound effect in other places. Subsequently, it can cause issues, irritation, like where? The low back. And so we have to make sure that when it's examined properly, that you look at it from multifaceted. You got to look at that distortion pattern that occurs when somebody's walking. One of the things that we always do when somebody comes in with low back pain is we have them walk. Walk? Why would you want them walk? Because you want to see the mechanics. But we watch them walk not only from the back, with their shoes off, by the way, but we watch them walk from the side. And we watch the position of their head. We watch how they hold their mouth. We watch if they're clenching their teeth. How many of you can honestly say that you never chew gum on a regular basis? Hopefully a lot of you. How many of you say that you go to the dentist and when they put that carbon paper in your mouth, that you're doing it in an upright position, either fully sitting up straight or standing, which is the way it should be done. And then they balance it that way. I care to say that the last piece, not too many of you. So what does, that mechanism have to do with your health? Well, it causes other pressures to occur. One, you got a head, most of us do. 22 bones that make it up, that hard noggin of yours, and that computer called your brain sits in between it. And when you breathe in and you breathe out, the 22 bones that make up that hard element called your skull move millimetrically. They tug on a very thick fascial sheath. It's called the dura, hard matter, matter, and it helps pump spinal fluid up and down the spine. So if that's the case, if it pumps spinal fluid up and down the spine, then it's either doing it normally or it's doing it aberrantly. Now, if it's aberrantly, then you're going to get distortion patterns. The body has to compensate. And it can compensate because of, its inability to move properly. Muscles go into spasm. When muscles go into spasm, joint spaces misalign. When joint spaces misalign, you have nerve root irritation. And depending on where those nerves go, you can end up with more problems with their targets. What are the targets? Well, real simple. The targets could be simply, the bladder. The targets could be the ovaries. The targets could be the erectile area, guys, the stuff that you're going to the drugstore and getting, all the ED, medications for. It could be your low back. And that low back could have started with your temporomandibular joint because it's not aligned properly, or you're missing teeth. If you don't have teeth in the back, by definition, your TMJ, your temporomandibular joint, is not going to be aligned properly. And you have a muscle in the hinge of your jaw, the temporomandibular joint. It's called the pterygoid muscle. It's actually spelled PT, not T. So pterygoid or pterygoid muscle. And if that muscle is in spasm, because you're clenching, you're chewing, you're doing things aberrantly, then your abduction, your outside movement of your hip is going to be extremely restricted. And there's an easy way of figuring that out and finding it. Once you find it, you can fix it. What a concept, right? But you have to ask the questions. You have to watch people move. And like I said, we watch people move. We watch them standing. We watch the position of their balance. We have them close their eyes. We have them move their body in different mechanisms. And there's a linkage. There's an intimacy that you have to be aware of. If you are aware of it, meaning the doctor, and you know the relationships from one area of the body to the other, like your shoulder and your hip and your elbow and your knee and so forth, you can come up with a better diagnostic. And then subsequently, because of that better diagnostic, you might actually get rid of the problem where everybody else has been localizing the situation. If it's my low back and my waistline, I'm going to go after that. I'm going to decompress it. I'm going to do whatever it takes to, fix that piece. Well, that's good. And you might get a little temporary resolution of it, but it comes right back. It doesn't hold because you didn't fix the cause. Why didn't you fix the cause? Because you didn't ask the right questions. You have to ask the right questions to resolve the issue. So I don't know about you, but when I have a problem, I want to find out what the trigger is. I want to find out what the mechanism is to fix it permanently, if it's possible to fix it permanently. And I'm here to tell you that most situations can be resolved permanently if you ask the right questions and you understand the intimacy, the interrelationship, the linkage between it. So on the 16th, coming up in about, a week and a half from now, Wednesday evening, 6 p.m. at the Roselle Center in Fairfax. Join us. Join Dr. Harlan Browning and yours truly. And we're going to tag team. We're going to go back and forth, and we're going to answer questions. And I'm going to demonstrate, more importantly, I'm going to show you how some of these things actually occur, but more importantly, what what the effect is, and then the best piece is how you fix them. And we're going to, even if you don't do anything but show up and we give you things preventatively and we make you aware of certain things. And that's why we do these in-house programs, by the way, is to educate you, to give you the data, to give you the information so you can become better. You can become more effective in your life because your body's working. It's not hurting. You get rid of the pain. But a lot of us just sit. I have a patient that is a great guy, a little bit of a curmudgeon, and he's got very advanced spinal deterioration. And when he came in, he's one of these guys, I don't know why I'm here. Nobody's else been able to help us. And I said, okay, let me check you out. So we checked him out and I said, yeah, you got all kinds of problems. And, I said, tell me what you've done. And he goes through the litany and the drugs and the injections and, the physical therapeutics he's had, and he's still in the same place. He sits all day long. And here's a guy who's really quite an amazing man. I like him a lot. And I give him a hard time on an ongoing basis, simply to jag him, to get him to really understand that there's a way. But when he first came into the practice, he couldn't lie on the table. He couldn't lie flat. And, he's, oh, I can't get on the table, right? So we examined him in a seated position, had him stand up. He was on a cane, actually a quad cane, and very slow in his motion and so forth. And so we started doing reflexive patterns and work and so forth. And one of the things we went after is that temporomandibular joint. And now, and it hasn't been a long period of time, we've treated him about 4 weeks, maybe going into the 5th week, and doing a lot of different modalities. And this week, the beginning of the week, I said, let me see if you get on the table. And he gets on the table very slowly and bringing his leg up. And I said, look at you. You actually got down, face down on the table. Oh my gosh. So I started treating him on the table that day. And he got up and he was trying to hide this look of, smile, appreciation, anticipation. He went in his curmudgeon state. And I started telling him, I said, wow, I said, maybe we're going to get some resolution here. And he just looks at me and he gets, he goes into his spin. I said, listen, man, I said, why don't you develop an attitude of this can be doable, right? You can fix this. And, when you look at his dietary patterns in his life history, and guy was a great athlete way back in the day. But he let himself get out of control, but he never fixed the fuel that was going in, the cold cuts on white bread and canned soups and beans and things like that. I said, no wonder you feel like hell. You're putting an inflammatory pattern in your body that continues to make things worse and set the stage for other things to happen. Does he have stenosis? You bet. Is this completely, totally permanent? On him and what he's willing to do to reverse and resolve certain things. So if he can resolve it, even to the point where we can reverse it 65, 70%, now the man has got his life back. He can do things that he couldn't do before. He's out of the chair. He even forgot the other day, and he had his quad cane. He got from the table and walked over to get his stuff, the counter, his wallet and so forth off the top. And he looks around and says, where's my cane? I said, I got it in my hand. And he just looked at me because he knew what I was trying to indicate with him. But think about that. Think about your low back and think about your history. Did you ever take a blow in the face? Did you, crack a tooth? Did something happen to you that affected your skull, shifted those 22 bones of your head? So now the alignment is not normal. I want you to think through the process. I want you to realize and understand that most of what takes place in our life, particularly when it comes to low back problems, is a result of our not paying attention the way we should pay attention to. A lot of it's going to come from your feet. A lot of you have lost your arches. Is it a matter of putting the arch in and living the rest of your life with inserts? There's ways of strengthening the arch. You may need a temporary lift in there. It has to be done, designed properly. One of the things that we do with patients, everyone that comes in, we watch their gait pattern, but we have them walk over a pad. We have them stand on the pad. Why do we do that? Because we want to see balance. We want to see if the foot, one side and the other, are equal in the pressure. Is it within 1 degree, front to back, side to side, relative to their postural pendular effect? If it's not, it tells us the body's compensating for something. If things are more to the left side, and it's called antalgia, position away from pain, that tells me that we've got something on that right. And if I can't find it, I better dig a little deeper. I better look hard to find that mechanism. Often it's basics, but we forget to ask the question, what is taking place? What needs to happen because of the history? Not because of the decision that we made about the pain when the person walks in. Oh, you have back pain. Take this. Let's see what happens if we knock the inflammation down. We push on the area. Oh, it's coming from right here. But does it answer the question why it's coming from there? What's the reflexive mechanism? We know that the intestinal system refers to the low back because those are the nerves that make the intestinal tract work properly. So if you got a lousy diet and you have an inflamed intestinal system, you're not digesting food the way you're supposed to because you're screwing it up like a cesspool. Could you possibly have low back pain? You betcha you could. What happens if you've been clenching and on an ongoing basis? It just doesn't affect your head and give you a headache. The muscles of that temporomandibular joint have a direct input to the muscles that control lateral motion of your hip, called abduction or adduction. And then all the neurological relationships, the intimacies of all those pieces. Wouldn't it be cool to find out that there might be something that you could do about it if it's looked at properly, if the diagnosis is the way it was meant to be, meaning not where is the pain, what's the swelling around it, but more importantly, where is it coming from, what triggered it, where did it start from, and then fix that. I don't know about you, but I'm not done yet. I don't want to be confined to a chair. And the majority of us will be confined to our rockers, to the chair in front of the television with a remote control in our hand, ultimately going into assisted living facility, whenever length of time that is, when you can't do it anymore, when there's nobody around to help you. So why don't you join us the 16th at the Roselle Center for Healing in Fairfax, 6 p.m. Dr. Harlan Browning, the professor, and I will be going back and forth. And I promise you, we're going to give you more information than you thought was possible when it came to the low back. And more importantly, to be able to prevent further occurrences, to help you understand why it's there, and then put the decision in your lap. What do you want to do about fixing yourself? I don't know about you, but you give me that data and I'm going to run with it, my friends. I'm going to make sure that I can turn things around. 16th, 6 p.m., Roselle Center for Healing in Fairfax. It's a Wednesday night. Join me. Remember, I'm here every Sunday giving you as much data as I can, sometimes just to provoke you, to make you think through the process. You know what happens then? It's on you. You're the one that's responsible. Once you know, then it's in your hands. And if you ignore it afterwards, then there's a problem. Join me right now on live stream. We're going to go right over drtomroselle.com. Hit the button. You'll see it. Follow me. You can do it on your phones or anyplace else. If you're on social media, you'll find us right now. Anyway, remember, I'm here every Sunday. One reason. I love you all. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.